This is Chapter 16, Health Problems of School-Age Children and Adolescents, Part 2, and now we're going to talk about obesity. Obesity is defined as increase in body weight due to the accumulation of excessive body fat, and it's generally considered obesity is when you're at the 95th percentile or above for age and gender and height. So this is not the person whose weight is at the 95th and their height is at the 95th. This is where you take the weight and height, and so they are at the 95th percentile of weight for someone at their height. So it's not just the age to weight. And then overweight is at the 90th percentile. And 25 to 30% of children are obese. And so there is a genetic predisposition for this. And those kids, they may have eating habits based on their family, or they're not active, or just their metabolism. And so they become fat infants who become then obese children. There's this balance between eating and getting energy and burning off that energy. So then they eat to have enough energy, but as soon as that energy kind of wears off, they don't have any energy because they've got all this extra fat they're carrying around. There's also the psychological component that plays into it, that they feel guilty or ashamed of being fat, and eating makes them feel good, so then they eat to feel better, but that contributes to being overweight and obese. So it's kind of turns into a vicious cycle. So some of the problems, though, we're seeing an increase in type 2 diabetes among kids. It used to not really exist, and now it does. If you're an obese child, you will probably be an obese adult. You're at much higher risk. We're seeing hypertension, hyperlipidemia, and cardiovascular disease at much younger ages. Being obese also contributes to social isolation, low self-esteem, and depression. These kids, they feel bad about being obese. They can't go out and play and keep up with the other kids, so they don't. And then that kind of triggers that whole staying home alone and eating cycle. So some things to think about. We really want to work on a healthy diet and exercise, and getting them into some group therapy or into a group where they can be active. Other people who are doing the same understand what they're going through is always helpful. So we don't really use medical therapies with kids. The medications are not recommended, and surgery can be hazardous in children. The sorts of weight loss surgeries they do with adults, we do not want to do when a child is still growing. So we really want to focus on diet and exercise and getting them out there and playing with the other kids and not feeling isolated and eating. School phobia. These are kids who are really resistant to going to school. So it's not just they say I don't like school, it's that they have kind of a panic attack at the thought of going to school. It's a severe anxiety of going to school. Can also be called school refusal or school avoidance. So we've got to figure out what's going on that's making them so fearful of school, and then how we're going to treat it's going to depend on what that cause is. But letting them stay home is not helpful, because the longer they're out of school, the more fear they're going to have trying to get them back in. This needs to be taken seriously, though. I mean, they're truly having a panic attack, physiologic reaction when they think about going to school. So it really is something that's going to take some intervention, not just telling them they have to go. There's a lot in this chapter that we're not going to be doing on our exam, all the reproductive health. Hopefully you did most of that in OB, including the sexually transmitted infections. We're not going to do those here. Eating disorders, substance abuse, suicide are all going to be in psych.